Well, hello there. I'm Fred Upton.
And I'm Diana DeGette.
And I'm a Republican from Michigan.
And I'm a Democrat from Colorado.
You know, we know that you've probably heard a lot about the gridlock, dysfunction, and division in Congress for sure.
It's true. We do have our differences. Fred and I don't agree on everything, but we do agree on this. America can be, it must be, the healthcare innovation capital of the world.
You know, you may not realize it, but together, we have already accomplished a lot to improve public health with a whole number of bills supporting medical research enacted over the last couple of years. I'm also proud to say that I helped lead the charge back in the 1990s, bipartisan effort, to double the funding of the National Institutes of Health.
This is a good start, but now it's time to go bigger.
You know, in the 21st century, healthcare innovation is happening at lightning speed. From the mapping of the human genome to the risk of personalized medicines that are linked to advances in molecular medicine, we've seen constant breakthroughs that are changing the face of disease treatment, management, and certainly cures.
Health research is moving quickly, but the federal drug and device approval apparatus is still, in many ways, the relic of another era. We have dedicated scientists and bold leaders at agencies like the NIH and the FDA. But when our laws don't keep pace with innovation, we all lose out.
So if we want to save more lives, and we do, and keep the country the leader in medical innovation and the jobs here, we've got to make sure that there's not a major gap between the science of cures and the way that we actually regulate these therapies.
That's why, for the first time ever, we in Congress are going to take a comprehensive look at what steps we can take to accelerate the pace of cures in America. We're looking at the full arc of this process, from the discovery of clues in basic science, to streamlining the drug and device development process, to unleashing the power of digital medicine and social media at the treatment delivery phase.
You know, all of that is so exciting, but we know that we don't have all the answers. That's why we're asking questions first. We want to listen, and we are. We want to know how to close the gaps between advances in scientific knowledge about cures and the regulatory policies that are created to save more lives.
How can we make sure our best scientists spend more of their time in the laboratory discovering cures rather than just writing grant proposals?
And how can we foster even more collaboration using new technological resources like cloud computing or social media?
Are there new ways to improve the process of developing and approving new drugs and devices?
You know, our understanding of disease at the genetic level can certainly help reduce the costs and quicken the pace of clinical trials. That means patients potentially have faster access to those treatments. What do we need to make this happen?
To keep things moving and constantly improving, we must then capture the impact of these new drugs and devices and share that data with researchers, caregivers, and patients.
Working together, that'll ensure that the discovery process continues to move forward, constantly improving and learning.
And by this collaborative effort, asking these important questions and constantly challenging ourselves to always be doing more and doing better, we can put America on a swift trajectory to make the predominant diseases of today a thing of the past.
First discovery, then development, then delivery, and back again to discovery. We must never cease. Our efforts for 21st century cures is now underway.